or working. For example, now during the political campaigns, I met a few families where individuals were working in campaigns, not getting paid, but they did get, housing and so on. These are not cases of failure to launch. The outcomes of failing to launch, which again, just so I can give you the basics, so you have some kind of picture in your mind. Living parents, not working, not going to school, not mentally debilitated, so it's not schizophrenia, not autism, and physically able. All right. The outcomes of being in this status of failure to launch, know that I'm saying status, not mental health condition. It's not like having depression. It's more of a status, like being homeless. Mentally, it leads to social isolation, depression, suicidality. From a health perspective, being so housebound, there's elements in physical health that get ruined, like hypertension, blood pressure, weight increase, sleep disorders. On the parents, there's serious parenthood difficulty, anxiety, high monthly expenditure, a lot of shame and self-blame, talking about your child with other individuals when you feel that you failed. And then the societal price, when a chunk of the population is now working, for example, not paying taxes. Now, regarding this last point, yes, this is a societal problem because there's a big amount of people in this status. And how would I have known that? Because this was an unknown when I started to do my research. I actually studied the prevalence. So we had two big questions. This leads me to a first study I want to tell you about. What is the prevalence of FTL and what is the effect or the sociodemographic effect of FTL? And a third question is FTL an actual burden on parents? Finally, we wanted to know whether FTL is indeed associated with mental health issues and which ones. So what I've done is the first prevalence study. We worked with a company called Ipsos International. They have a panel that represents the entirety of the US, 60,000, 65,000 individuals that represent the population. And what we did is we reached out to adults who support other adults. And the reason is individuals who fail at launch, in my experience, do not cooperate well with surveys and when being questioned, probably because of shame. So we went and looked for people who support other people, trying to see if the people that are being supported have failed at launch. We use a screener, I won't get into that, and use all sorts of measures of demographics and so on. The numbers we're reaching is that there's about 3 million individuals in the US with failed at launch, right? It's a huge amount. It's as much as people as, Vegas, DC, Houston, Boston combined, 3 million individuals. This is a chunk of the gross domestic product. That's why I said earlier, this is a societal problem. So it's Boston, Atlanta, Seattle, and Vegas combined. Individuals with FTL are usually between age 18 and 59. I work now with a family from Connecticut with a 50-year-old adult child who I work with the parents. Average age is around 27, and there's a majority of male. I can talk why there's more men than women later. Overall population corresponds to demographically with the general population in the US. And there's some socioeconomic characterization, but overall it's quite similar to the way that the US is dispersed. Clearly, individuals who do not have a room to put another person in or don't have a house to, house their young adult child would be less likely to support an individual failure of launch, but not that much more. There we see a little bit more Hispanic families, but this might be a function of birth per woman in the Hispanic community. Okay, about the burden. Parents report high caregiver burden. 15% of parents report very high caregiver burden, equivalent to that of supporting a family member with Parkinson's disease, which I find just staggering. Thinking about the fact that it's about 450,000 Americans, they support an individual with failed launch and say it's as hard as supporting a family member with Parkinson, right? This is extremely substantial. Overall parent monthly expenditure is about $1.3 billion a month, and lost tax revenue to salary is about $16 billion. So this is a major problem. Mental health, most frequently endorsed mental health problem with individuals with failed launch is anxiety. Anxiety includes anxiety, generalized anxiety, social anxiety, OCD, but not PTSD. We excluded for PTSD. Number two is depression. And in 5.4% of cases, a formally diagnosed anxiety disorder was indicated by the supporting individual as the reason for failure to launch. Okay? Anxiety may be, and because of this, I would say anxiety is probably an excellent target for interventions to reduce failure to launch. So there's many different factors that can be connected with failure to launch. Anxiety, personality disorders, some biological factors, very interesting, social, cultural, depression, and other psychological personality disorders. But again, since anxiety is such a major element, that's what makes it a good target. So again, I don't have my notes, but I can say, or I think I can read it here. I went into a forum of individuals who failed to launch and looked a little bit about the information they described. And one individual described a fear of adulting. That's her anxiety, just to give you a call on how it looks like. And she said, I'm afraid that when I come to rent a place on my own, I'll miss something on the contract and then something tragic will happen, right? So individuals who failed to launch describe in the more organized cases, they can actually describe their anxiety and talk about the anxiety of becoming a independent individual. Treating anxiety, so this kind of raises questions. So if you have these individuals, they don't work, don't go to school, they're very anxious, why don't we send them to therapy? Why don't we give them psychiatric medication? Now, treating anxiety in individuals with failed launch is hardly possible. If you have a person who is extremely not cooperative and doesn't want to come out of their house, even now with Zoom, results are not effective. They're not cooperative, they're isolated, non-responsive. Alternative therapy methods are not empirically supported, and there are some. There's, when a therapist comes to your house, there's wilderness camps. They're very interesting ideas, but they're not well supported research-wise. Potential solution is intervention for parents of individuals with failure to launch that focus on the anxiety and does not involve the adult who is uncooperative. So the individual, I called him Brian. Brian is not his real name. Neither is Ron, which is another name I chose. Ron's parents in this story were doing his laundry, serving him food, driving him to doctor appointments. They themselves had to set because it was too anxious to make the doctor's appointments. And they had a lot of daily reminders of how their son is not functioning. More than that, they were over the top. They had extremely burdened by his presence. They were stopped. They severed connections with family members, with friends, because they were so ashamed. They didn't have a guest in their house for 10 years, as far as I remember. So working with these individuals who are extremely motivated and willing to take the risk is a great way to work. All right. Family accommodation in failed launch. Family accommodation describes behaviors that family members do in order to reduce the anxiety, in a way, of the individual. However, these behaviors are not helpful. They're in response to symptoms, but they do not decrease anxiety. For example, I've spoken yesterday to a mother who spoke with her son over the phone for 6 hours or 7 hours. And he was very anxious, and every time she wanted to hang up, he started crying, saying, "No, no, 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 no." 20 years old. Another example would be an individual who, these are examples of family accommodation in young or adult individuals. A young man who asked his father to stay in the bathroom while the child, the young adult, is taking a shower because he was afraid to faint due to the vapor, the water vapor in the shower. Classic is a young adult or even a child that goes to a restaurant with his parents and is unwilling to speak to the waitress and to take an order, and then the parents make the order for them. So these are all examples of family accommodation. They also appear in individuals, adult individuals. However, there's one element in adults that we can't see in children, and that is you provide a parent of an adult child provides housing, insurance, lots of things, right? It costs a lot of money that come as a shield between the young adult and the real world. Okay. Whereas that's what you're expected to do with a child, right? You're supposed by law to provide your child with housing, heating, and so on. Okay. SPACE is supportive parenting for anxious childhood emotion. It's a method developed by Dr. Eli Lebovitz, and it is focused on teaching how to reduce family accommodation in a supportive way. It's manualized parent-based treatment for childhood anxiety, and it's tested in clinical trials with parents of youth, including randomized control trials. It places accommodation reduction at the core of its theoretical foundation and treatment objectives. Preliminary and encouraging results were found in failure to launch. So I adapted SPACE to failure to launch. And SPACE FTL indicates 5 key components. Psychoeducation. During the therapy, we teach parents about anxiety, about family accommodation, and how we reduce one to affect the other. That's how you reduce parental accommodation. What is the target? Some of the targets of reducing family accommodation are very clear, right? So for example, if your child texts you 40 times a day, you should reduce the amount of times you answer, because when you answer, you theoretically reduce their anxiety, they calm down, but then that's the thing that makes them calm down, right? Not the fact that they kind of realize that it's okay to be afraid that you'll die and not text you. Okay, increasing parental support. When you reduce family accommodation, you want to be supportive. You want to tell the child, I see your anxiety. I believe you can overcome your anxiety. De-escalation. SPACE is a derivative of nonviolent resistance, which is a treatment method based on an Eastern philosophy. And the idea is that we don't force our will on others, and how we don't use sort of violence in order to change the individuals. Okay. And engaging supporters, how we make connections with people, family, friends of the individual in order to bring on this change. Okay. I've completed the online, SPACE FTL pilot study. I don't want to go too much into the schematics here, but we had 40 families from across the US. This was an online study started during COVID. 20 families completed a failure to launch, and during that time, there's 20 people who were in a waiting list. So that's the comparison. So it's a randomized whether to wait or to start sessions. And of course, the young adult is not involved in the sessions. You work only with the parents. Okay. I know that the science here is less interesting for most of you. I'll just say that status is measured before and after the treatment. Severity is measured, anxiety, depression, parent burden, family accommodation. The study was found that the method is feasible and it's acceptable and it's satisfactory for the individuals who do it. Probably this is the most important graph. We have the FTL status, right? So before treatment in both people who received the treatment and people who were in the wait list, 100% of the kids were, the young adults were with failure to launch because that was the inclusion criteria, right? Question is, how many were reduced? And in the wait list was 16 weeks on average, so was the treatment. For 16 weeks, we had zero change. So zero individuals in the wait list have started to work or school or moved out or anything of the sort. And it's not a big surprise. These conditions turn to be kind of not necessarily chronic, but long lasting. Whereas with space FTL, we reduced the FTL status in 60%. And when you look at it, what happened is that out of the whole lot, 2 have moved out. Out of 20, 2 have moved out. 6 started full-time jobs. 3 started part-time jobs, and 5 started school or started taking courses, or if they had like 1 or 2 courses or like half a credit, they actually started taking more credits. Okay. Symptom severity is decreased, and adaptive behavioral scales have increased. So symptom severity would be how much they avoided, for example, how much they avoided public interaction, and adaptive behaviors is more towards the, how they acted around the house and with other adults. 1 second, I see people in the waiting room. Let's let them in. All right. Okay. Anxiety, we didn't see a change in the anxiety. We didn't see a change in depression. I'm not sure we should have seen this. I'll be happy to explain later. We see a substantial decrease in parental burden and a substantial decrease in the level of family accommodation. Bottom line, space FTL is feasible, acceptable, satisfactory. It increases the independence of individuals who fail to launch, reduces their symptom severity, has some effect on anxiety, reduces parents' burden, reduces family accommodation. Okay, so I want to see how I am with time and not get you too much into the nitty-gritty details of the research. Let me jump into something else. Here, when Ron was a child, his parents describe him as an anxious child who spends most of his time online. Talking to all these parents about their children as part of the intake process, I learned a lot about what children potentially grow to be individuals in FT with failure to launch. I mean, no yearbook puts a rubric says, less likely to succeed, clearly. So this is an interesting thing because my holy grail would probably be, can we identify failure to launch at young age and can we prevent it? So we're looking for risk factors all the time. For that purpose, I did a retrospective study. I found data in something called the Health, Adult to Adolescents Health. It's a study running back from the 80s, and you can look at individuals today, how they are today, and how they were as children. And I examined several potential risk factors. Again, I don't want to overbear you with the details, but it's a study. There's over 20,000 people, and if you pay, you can use their data. And I used information from ages 18 to 31. I found individuals who seemed to match the trait of failure to launch, and I identified 5 factors that can lead or are more common in individuals who later in life have failure to launch. There's mental health, low social interactions. They have less friends. They do worse in school, in scores, in cooperating with teachers and such. They consume more media, and they seem to reach physical maturity later than their cohort. I later examined the same data with another sample, with another database called the PSID, the Panel Study for Income Dynamics. So we can say overall, there are risk factors for failure to launch. And as we move forward with research, maybe we can create a prevention curve. I think this is enough. I would say that there's a few interesting future directions. I may start doing space work in Montefiore. I'm supposed to open a clinic there. I've seen very interesting things about physical activity, that increase in physical activity can help. It's another way to look at why working with parents work in failed to launch, and of course, prevention. Okay, all right. So as I know that you're not looking for science talk probably, and you have more questions about what this is and how we work. I think the research part was Paul, correct me if I'm wrong. I think that this was a good dose.
Right. I think it was. I might ask you right off the bat, though, to define dread, because there is some kind of, I think it relates to the shame of someone that is
All right.
experiencing it, but it could relate to the parents. So I'll let you handle that.
Okay. All right. I've haven't. This is an idea that I've been carrying for several years. Hopefully, I'll be able to talk about it in May. Right. When you work with parents on reducing family accommodation, we encounter a phenomenon. Therapists encounter a phenomenon where parents are, I would not say sort of reluctant or non-compliant with what the therapist described as reducing family accommodation. Let's say your child, let's take the easiest case, your child is afraid of spiders. And the way to reduce anxiety is 99.999% of the cases, it's exposure, right? If you're afraid of spiders and you hold a spider in your hand and you see that nothing happens after so much time, your system, your anxiety system, let's call it like this, is being habituated, and that's it. And there would be cases, if we take this as an, analog way of looking at failed launch, where parents would say, okay, I mean, please don't put a spider in my kid's hands. Now we need to ask why is that? Well, maybe the spider is dangerous, my kid would not be able to deal with it, and so on and so on. To kind of capture this, I didn't like to use the term resistance, which is a term in psychotherapy on why a patient is not complying with the psychotherapist. I rather use the term dread, because it really captures what a lot of parents feel when it comes to adults with failed to launch. A fear of taking these steps because of a potential negative outcome. Now, there's all sorts of negative outcomes. The common ones are, if I reduce family accommodation, I will destroy a relationship. My child may self-harm and kill himself. He may harm me. He may run away. So these are all sorts of elements of anxiety within the parent that may stand in the way of reducing family accommodation. The way to reduce dread is a big question. To some degree, it's also exposure to the parent. So in some cases, there's this what we call parallel processes where I will be working with the parent on reducing their anxiety while the parents are reducing the anxiety of the child. Dread is hard, it's real, and it's justified. I don't think that it's when you look at the old literature on resisting therapy, it's very judgmental. And I don't think that's a problem. I think parents react to a real signs of distress that are coming off their child. We do know that people do not harm themselves because of anxiety. The person may run away, but then again, if a person who's stuck in his room runs away and say, I don't want to be in this house, and goes to the library to work on their computer because the parents shut down the Wi-Fi, is it a failure or is it a success, right? For a person who's having such a hard experience when going up. So yes, a major element in working with parents and reducing family accommodation is asking yourself as a therapist, what would I be doing with a dread?
Thank you.
I, I hope this kind of captures it.
Yeah, thank you. And if anybody has a question, they can just unmute themselves.
Thank you for your presentation. Um,
Elisa,
the space study, how recently did you do that?
we completed the study in, I think the last family was 2023 or the end of 2022.
And will you then be following those families past the
Basically,
study?
I originally I did collect some data for the 6 months follow-up, but I uh, didn't have the resources to actually carry on for a long time. Yeah, unfortunately, would love that. There's a big question on not just what happens after therapy, what happens in general. And I do have some data that shows that some individuals with failure to launch would not fit um, the classification as having failed to launch after several years for several reasons. Some of them for good reasons, like they'll start working. Some of them probably because maybe they were in prodromal state, maybe they were in a state that precedes schizophrenia, and then they're schizophrenic, so we're not calling it failed launch. Some of them are just get married, have children, they become caregivers, they become housewives, which is a technically a good option. And some continue to be dysfunctional over time. But I don't have a good answer on the development of failed launch, and neither individuals who study this phenomenon from different perspectives. So there's different ways of looking at failed launch. I'm a clinical psychologist. My view is therapeutic, but you can see from a psychiatric point of view or from an economic point of view how these things may develop. But I've not seen a single good source that can say where, over time, where is the trajectory. I have my data that we haven't published yet, and pretty much to show this, individuals who failed to launch at one time point are more likely to show the symptoms of failure to launch as they move forward. And I do have some new data that it's interesting that you asked the question, but I did see today, and we're trying to answer the question, are we seeing more individuals with failed launch or less throughout the years? And it seems to be pretty much the same. So, with all this view of, internet generation and online kids, and, if you know the works of Paul Haidt and, the anxiety generation, it might be incorrect when in relation to failure to launch. This might just be some subset of the population that just carries on, and we're just doing a very bad job targeting those individuals. Yeah,
Thank you.
you're welcome.
Could you talk about the training that therapists have to undergo to be qualified to, work with parents on space?
At this point, Dr. Lebowitz does provide training for space, and there's in addition for the basic training, there's a few more hours, 6 hours for failure to launch. Another way of working towards working with parents of individuals with failed to launch is doing the nonviolent resistance training. And I think they now have some sort of a certification program. And then there's some options in Japan, which I'm less aware of, and I don't I from the works that I've seen, I'm not convinced it's a good method. But here's the problem. We're barely showing that there's this phenomenon. It's so common, so there's not a lot of therapists who actually know what to do with it. And rightly so. This is extremely scary. As a therapist working with parents of a potentially suicidal adult who is not seeing a therapist, a lot of therapists would, push this away. Although, who needs more help, right? I mean, the people who have the fear of losing the thing that is most dear to them and not finding therapists who can provide help. So I hope in the future there will be more options. Yeah.
Well, I do know in our area that there are several therapists that have been trained under Dr. Lebovitz.
Yes, and some have done the FTL segment, but I've been told by individuals that a lot of therapists don't feel comfortable once it becomes, tough. And many times it's very, very tough.
I have a question. I'm imagining, based on the size of the, I was taken by the $3 million people,
Mhm.
but and that your criteria was those that are not or have not been involved with, I think you said heavy drugs, let's say opiates.
Yeah.
So if someone had been involved with opiates and they're in recovery, does that amplify the potential for failure to launch, or
I think it's a good
minimize
question. In our data, we did not include individuals who are now in recovery. So individuals who are, for example, living in residential programs for recovery, which are in many cases are not even allowed to work. So, we didn't include these individuals. Now, let's say 2 years in recovery, 3 years in recovery, when you're not a part of any program. My experience with opiates users in the Bronx, which I don't know if I can generalize necessarily, is that of individuals who are not probably they're not probably more likely to be failing to launch. I don't think so. I think that individuals who have been using heavily to the point that they were addicted and they went through therapy, in most cases, they have a better experience. They're a better experience in living outside their parents' houses and finding jobs and finding something. In that sense, they maybe are not necessarily in the right milestones from a mental health perspective of dealing with their hardship, but as being a functioning adult, a lot of individuals who have been through the drug use path, they've done that. I mean, a lot of drug users, heavy drug users, have held jobs, not necessarily for a long time, but they have held jobs. They've been out there. They've raised families. So I don't know about substance use as I don't know if drugs is like a gateway to fail to launch. I think that's no, probably not. The gateway is probably high school, college time, repeated failure, those kind of things. Yeah. And marijuana is there. There's no question about it. Marijuana is there, but it's not the main thing, probably.
one other follow-up? Was there any, when you were looking at their upbringing, which you touched on, was there any data on parents that were, I don't know if you got this or not, parents that were unrealistically, what's the word? expectation of their child's
I
success?
start the sessions with every parent, pretty much in the same way, saying the same words. And they are that I have worked with families from very different backgrounds. Very rich, very poor, immigrants, people whose, ancestors came down the Mayflower, gay, straight, very strict, very authoritarian, but then also very soft and very permissive. And I am not seeing a common thread. I really am not. So one would say, okay, you have parents who were, extremely demanding, authoritarian, and they were, yeah, but there's parents who were extremely opposite. They were extremely permissive. So I don't think there's one way to reach the status of failure to launch. I think there's several paths. It's easier to think about this a little bit like homelessness, right? If you have a homeless individuals, there's many ways to become homeless. And yes, mental health is one of the major gateways, but there are other ways, and not every mental health situation would lead to, right? But I would not say that the parental behavior in childhood is the reason for failure to launch. Not in that sense. I don't think that the parents can hold all of this, responsibility. It's some kind of combination between child, parent, environment that create the situation, and then at the age of 18, it is just right to not jump out and not succeed. And then the real problem starts. Because once you fall into what we call the accommodation trap, when the kid says, I want something, I need something for my anxiety, and the parent says, all right, enough. Okay, you had enough. You should be by yourself. You should. And then the child usually becomes more anxious, the parents becomes more accommodating, and they just start to spiral. I have a case, I always give that example, and they allowed me to. One individual's age 24, has a service background, substantial service background, no PTSD, because I say so because he has military background. The age of 24, he was supposed to do a major exam in his field to become credentialed. His father was very anxious about it and didn't want to work and pay rent. And his father said, just move in with me. Parents were divorced. Move in with me and live with me, and just, I'll take care of everything. You just study to your exam. 12 years later, after he didn't go to the exam, 12 years later, the mother calls me and says, listen, I have this opportunity. The father has to renovate the house, and the 32-year-old now, or 36-year-old now, is going to move in with me, and I'm willing to go the distance, and I'm not gonna give up on him. 5 months later, he passed the exam. He's now credentialed, and now he can work in his field, in his state. So what happened in those 12 years? Where did he go? What was the vortex, right, that pulled him down? And no matter what we're going to say about the parents' behavior when he was 12, I mean, he had a life from 18 to 24. He served his country. He studied. What happened in those 12 years? That is best explained through family dynamic, not through family behavior when he was a child. I mean, I'm not saying it has no effect, but we want to understand failure to launch. We should look at what's going on now. That's much better and works way better for us.
Thank you.
You're welcome.
Also, what happened in the 5 months? I'm interested in that.
So the mother basically said, listen, you want to live here. what you'll have to do is take steps toward independence. You have to take steps toward independence. And if you don't take steps toward independence, I won't throw you to the street, but I will not provide you more than the bare necessities. And when we think about why these individuals are asking for more than the bare necessities through the scope of anxiety or depression, we can understand that what they're asking for is to reduce their anxiety via internet, via we kind of in many of these let's say 80% of the cases, it's a person in a room watching online or television many hours. But I had one case where it was a young woman, 26 years old, that had an amazing library inside the house. And that's what she used to do. Every time her parents would tell her, you need to get a job, she would become anxious, yell at them, and bolt to the library and read until she calms down. The question is, what if there's no more books in that library? What happens? So here comes two things. First, what will happen through the trajectory for anxiety? Well, that's exposure. You're very anxious, you can't reduce your anxiety, and the world does not collapse. Maybe it's not such a bad thing. That's one. But from the parent's perspective, the question is she going to see the library without the books, run to the kitchen and cut her wrist? And it is not common that individuals kill themselves because of anxiety, because of other elements, because PTSD, because of schizophrenia, but not because of anxiety. So, and again, there's how you would, well, basically what you said is you can have these things. He was very enraged, but I mean, through our work together, he started volunteering in a Boys and Girls Club, followed by some hours he volunteered or worked for a family friend who was in his profession. And then he just, as a step toward independence, said, all right, I'm going to study to the exam. And he aced it. It's a lovely story.
Hi, Dr. Berger.
Denise?
It's Denise.
Hey, Denise.
I just
How are
gave
you?
you, yeah, great. I know I gave you a case. I hope it's working out. When you did the FTL study, you said you worked with the parents for, I think you said 16 weeks. Was that correct?
The average was 16 weeks. I was in a way under the gun because we wanted to stay close to a CBT protocol for anxiety, which are usually between 13 to 20 weeks. Technically, you should not, I don't see a reason why it shouldn't be more than 20 sessions. But if you reached session 40 and you see no change, session 20 and you see no change, you're not the right therapist for it. You should let somebody else try and say, I'm not doing a good job. You should start focusing on why you're not doing a good job in reducing the parents' dread, more so than reducing the family accommodation.
Were those like intensive meetings or were they like 60? I was just curious, like what the length of the parent intervention time was.
I'm not sure I understand. Can you repeat?
So when you were meeting them for those, about 16, 20 weeks, was that like every week, like for an hour?
Yeah, it was weekly sessions.
Okay.
Weekly session. Yeah.
Okay, thank you.
One more
Dee,
question.
did you have a question? You're unmuted.
Me?
Well, Dee is, well, maybe that's you too.
No, we're in separate places.
Oh, okay.
My last question for me is, where is the, I don't know how to, the word enabling is a fraught word sometimes. But, where does or does that not, it sounds like based on your criteria, that okay, based on, because you've done the work, your criteria, this person fits the criteria for failure to launch. So a parent's enabling a child or an adult, young adult, is that at play here at all as far as working through this, or are we way beyond that?
The concept of enabling was originally developed in the literature of addiction. And through the years, and well, let me say something else. Let's start with that. You know, sometimes say semantics is everything, and in therapy, since words is the main thing, semantics probably is everything. But we have another element, which is narrative. And narrative is extremely important in therapy. So in the years that the notion of enabling was developed, our view of addiction was skipping over many elements of why people would be using substance. The word was then changed from enabling to codependence, and now it is termed, which is also talking about the dependence, but now it talks about prodependence and the fact that parents do get something from this communication, sir. When you give them $100, but you see your child. So how does that come to play with the notion of what is family accommodation? Family accommodation is the most natural, not just natural in the sense of, oh, natural, no, natural in nature kind of thing to do. And why is that? We are wired to respond to the fear of our offspring. If you're a little monkey in the savannah and you see a big lion, you start crying and mother monkey comes and swoop you in, right? She changed her behavior. That's attachment theory. If my 3-year-old walks along with me in the street and sees a massive dog, I'll pick her up if she's afraid, right? Sure, I'm gonna give myself some leeway and say, well, don't be afraid of the massive beast that outweighs you 10 times, but this is still makes sense. But when a 16-year-old sees a Chihuahua and I pick up the 16-year-old, right? I am doing the 16-year-old a disservice. I'm coming between him, I'm shielding him from something that poses no risk, right? Because the lion can kill the monkey and a big dog can definitely bruise or potentially even kill a 3-year-old. But a Chihuahua cannot kill a 16-year-old. Why am I doing what I'm doing? Well, because he's anxious. But because I also have potentially my own anxiety and my own thing. But most of all, because he's anxious. Why am I shielding my 21, 22-year-old from the world outside? Potentially because I think that there's all sorts of dangers. My young adult may not cope, my young adult may break apart, and so on and so on. So is this enabling, really? Is that, when we think about it, is that a person who's doing something wrong? Because her fear about the world is sincere. They are afraid. There's this idea, we moved recently to a new house. We used the basement. My almost 8-year-old didn't want to go to the basement. He knows there's no ghost, but he was afraid. And as a father who does space, immediately I did the wrong thing. I said, just go down, there's no ghost. And of course that was the wrong thing to do. And then later I said, okay. Now I joke if he if he goes to the basement by himself, comes back, I tell him, oh, come on, you forgot to be afraid again. And he goes, oh man, Dad, I forgot to be afraid. But the core of the story is not the fact that he's not afraid. The core of the story, one night I was going to the bathroom. It's where the living space is. And I'm standing in the bathroom and I'm hearing the scariest voice ever behind me. And I'm turning and I'm seeing this little figure. And for that fraction of a second, there were ghosts in the world and they were real. And one of them was behind me. Now, clearly, it was my son. He had a hoarse voice and he just spoke like Darth Vader. But for that second, I felt the real fear that an 8-year-old is afraid when there's ghosts. Their fear is real. It is real. The fear of a failure to launch person is real. It's there. There is a real danger that the world will devour them and disassemble them. Is there a real risk, though? And that is not real. The risk is not there. There really is no ghost. And it is our job as parents not to provide a shield between the person and what he's exposed to. So that's, I hope it answers your question about
Oh, really good. Thank you.
You're welcome. Thank you.
Anybody else? We have time for one more.
I do have a question about hi, thank you for doing this. It's been very informative, and I was wondering whether I should click off at the beginning when you talked about who was included and who was excluded in your study, because our let's see, what is he? He's 40 years old and has been clean for almost 5 years now, I think, and yet he has a great deal of anxiety, and some of the past behavior I know carries a stigma in the world as far as getting a job, but I think it's more than that, and so and he also has palindromic rheumatism, and was diagnosed on the spectrum, finally adult autism, and so I was just curious as to was it resources, lack of resources, where you made your net sort of smaller so that you weren't including those people who were on the path to on the recovery path, and also who also had mental issues. Is that why?
So the answer is, the reason that I have excluded the phenomenons, substance use, autism, was for research perspective. There's different ways of thinking about an issue, and colleagues, for example, from the economics world would say, I want only 3 things. I want to know if the person's not working, not in school, and not in training. That's their typecast. That's what they're thinking of. Why we have a chunk of population that is not accumulating human wealth. School, work, or even volunteering is accumulating human wealth. My perspective, and I see individuals with autism, right? I do work with families whose child has autism. Adult child was diagnosed with autism. But the perspective is not one necessarily of anxiety. The perspective would be of changing family behaviors and changing parents' behavior. The scope of that is not what I did in the research, and it's called nonviolent resistance. We then call the individuals not emerging adults. Think about it in a way as different therapists, different researchers, all talking about a very close phenomenon, right? And it probably would never be encapsulated, just like homelessness. Some people are homeless, but then they pass 3 months in some friend's house and everything okay, and then they're homeless again. And we're trying each from their direction, trying to see how we can reduce the amount of people who fall into this category. From a therapeutic perspective, I would say no, there's work that can be done, and it's on how the parents reduce family accommodation in a way that would not drive the person back into substance use, because anxiety is substance use is a great way to reduce anxiety, right? That's across the board, specifically alcohol being the best, potentially, right? Who haven't had a person who before, a talk or something had a drink? I mean, it is common, it is self-medication. But yes, you can work on reducing family accommodation, though the research is not rich in that field. And the reason for that is entirely technical and is related to the way that research is funded, more so to whether this is working or not. The forefront of many fields usually is lacking when it comes to funds for research. A research like the one I've shown you was hiring me as a postdoc for 2 years. And Yale University, it's a very expensive donation that Dr. Lebovitz got in order to fund this. Now, in order to fund something that would include individuals with substance, a wider net, we just didn't have the funds for that. Unfortunately, we didn't have the funds for that. I hope that in the future, potentially under Montefiore, we can start collecting data and offer this to other population, other segments.
Thank you. And the one last is the anxiety which I see in my son. I suffer from it myself often. I deal with it better than he does, although he's learning. Is it physical or is it psychological, or both?
You know what? Well, of course, the answer for everything that has two options is always both, right? That's something that I learned through studying psychology. If you always ask an question, think that all the answers are correct. But I would say that when you're looking into the therapeutic processes, the narrative should be of something that is there, and you learn what to do with it. Rather than you have a parasite inside of you and you can erase it, you can't. I mean, technically, you cannot. I mean, either you're taking medication and you change something else, or some people put it deep inside and they build around it, and then it comes up when when their ego is depleted. But learning how to deal with your anxiety, just as you do, that's the way to go. I mean, by itself, it's not a bad. I mean, you're afraid of something. It's there, right?
Thank you.
You're welcome.
Well, Yuri, you extended your time beyond 8. I really appreciate that. And I was wondering if anyone else in the audience here, and Denise, I do want to thank you for introducing me to Yuri. But thank you, Yuri, for coming here today. I really appreciate it.
Thank you very much. I will sign my part. I mean, of course, if you know somebody and you have a question, and feel free to pass along my details through Paul or through Denise. If you know of people who are looking for individuals to give talks on failure to launch, I'm always happy to talk about this. I'm always happy to spread the word.